Welcome to Straight Talk with My OBMD podcast. Join me for a bi-weekly discussion on topics most relevant to women's health today. We are your source for medically accurate, real-world advice and all things related to your health and well-being as a woman. From menses to menopause, we've got you covered. I'm your host, Dr. Dana Smith, a fully practicing, board-certified OBGYN physician with close to 20 years experience. I am also the founder of the website that is 100% dedicated to women's health, myobmd.org. At myobmd.org, we write in all aspects related to women's health. Listen to our podcast, visit our website, subscribe to our newsletter, and follow us on Facebook and Instagram, myobmd.org. All right, welcome to another episode of Straight Talk with My OBMD. I'm your host, Dr. Dana Smith, founder of the amazing website, myobmd.org, where we publish material that is geared toward you, the patient, the female patient on all stages of life. Everything you read on myobmd.org, all of our material originates with physicians. So you can trust that the material that you're seeing, reading, listening to has medically sound advice, first of all, and has a real world application. We are in the trenches with you, and we want to be your source for reliable information online. Today, I am excited to continue our conversation with Dr. Amy Roskin. Dr. Amy Roskin is a fellow board-certified OBGYN physician, and she has transitioned into providing mental health care for the patients who we serve. So I'm going to allow Dr. Roskin to introduce herself and tell us about her and Seven Starling, which is the company she works with.
Well, thank you so much, Dr. Smith. It is a pleasure to be back chatting with you today. As you mentioned, I'm Dr. Amy Roskin. I'm the Chief Medical Officer at Seven Starling. We are a perinatal mental health care platform. As you also mentioned, my clinical background is as a board-certified OBGYN. I'm also certified in perinatal mental health. I was in private practice for 20 years. I've taught at medical schools, part of their faculty. And I'm really happy to be back and chat with you further about these issues today.
Awesome. And just so we are fully transparent, Dr. Roskin and I just recorded another podcast where we spoke about postpartum blues, postpartum depression, and postpartum psychosis. Now, we as physicians also want to speak to the patient who is experiencing recurrent pregnancy loss or infertility, because we know that the motherhood journey does not just begin at the time you give birth. That journey starts in your heart. And so we really wanted to have a conversation that addresses the mental health needs of the person who has experienced recurrent pregnancy loss, whether recurrent miscarriages or stillbirths or any of those really challenging situations, or the patient that is experiencing infertility. So, Dr. Roskin, tell us first of all, tell us about how does Seven Starling address the needs of the patient who is experiencing either recurrent pregnancy loss or infertility?
Well, we are at Seven Starling, we are a full service perinatal mental health digital platform for every stage of the motherhood journey. And so we manage perinatal mood and anxiety disorders for pregnant patients or postpartum patients, but we also care for patients who are on their fertility journeys or who have experienced loss through miscarriage or abortion.
Okay. Okay. So, and then the services that are provided through Seven Starling, are those all digital or in person? What are your options? What are the treatment options?
We meet our patients where they are, and so have found that to be most successful with digital. So we provide
Mm.
telehealth services so the patients could be in the comfort of their own home and seek out our services, whether that's individual therapy, group therapy, or psychiatric evaluation and medication management. All of those are available via telehealth in many states and coming to many more soon.
Awesome. Awesome. And will the patient need to have her physician refer her to Seven Starling, or can she self-refer?
Patients absolutely can self-refer. They can come to our website, www.sevenstarling.com. That's sevenstarling.com. And they can make an appointment with one of our care coordinators to review our services. And so we absolutely maximize access, and we are really committed to removing barriers from care. So patients can absolutely access our services directly. We participate with every major health insurance plan as well. That
Mhm.
being said, we are also very proud to work with thousands of OBGYN partners directly who we have developed a trust and relationship over the years and who refer us patients from their practices. We also partner with insurance plans and hospital systems. So I guess the answer is yes. However, patients come to us, we want to
Mhm.
be able to be that resource for them and provide them both education, screening, and direct care.
Okay, awesome. And I wanted to start with just really something that is maybe not too important for the patient. The medical definitions of infertility is an inability to conceive for 6 to 12 months, depending on your age for older ladies. But
Careful.
older 35.
Wow.
For the patient who is 35 or older, that number would be 6 months, and under that age would be 12 months. And the recurrent pregnancy loss is three or more pregnancy losses. However, as I stated, these numbers are truly not important because it really just depends on how you feel. And some ladies may experience a profound sense of loss after their first miscarriage, and some may be able to cope, even after experiencing a number of miscarriages. So, what we really want to focus on is just how you, as the person, feels in regards to your pregnancy and your motherhood journey. So, tell us about some of, when you lose someone, even if you don't know that person, right? So talking about, for instance, a pregnancy loss, when you lose someone, your parent, your whoever that may be, you're gonna have a grief associated with that, a reactive grief. So, um, and that's part of our human experience. That's part of what makes us human. Now, how do we know when this is a natural human reaction versus this may be something that I may need a little help with?
Well, thank you for mentioning that, Dr. Smith. I think it's key to think about these things in terms of severity
Hmm.
and time. And so I think that, for example, if you've been having these feelings of profound sadness, let's say from a miscarriage, and it's been going on, for years, that would be significant to me. And often there's something else going on, or there's a more complex situation that may require treatment. And the same goes for severity. If you're unable to function, um, unable to get out of bed,
Hmm.
unable to eat, if these symptoms are quite severe and they can be impacting your
Hmm.
life, um, then that may well be an indicator that this is a more serious condition or a serious reaction. And people react to things very differently, and there often could be, especially in terms of miscarriage, there can be a certain degree of social pressure oh,
Mm-hmm.
well, just move on from that. And that is not how it feels to many, many people.
Mm-hmm.
And people can take the time they need to grieve that loss and to
Mm-hmm.
process that loss. Um, and one of the things that we can provide, as you know, in terms of healthcare, is not just a safe space to process those feelings, but to provide the support that people need and the tools
Mm-hmm.
to deal with the feelings and how to manage them. And again, how to heal and how to
Mm-hmm.
process that.
Do you feel that the person who has experienced loss, sh how should I say this? Do you feel that all persons who have experienced loss of some kind should have some kind of screening done as they do during pregnancy?
You know, I think I can't think of many disadvantages to
Mm-hmm.
screening for that because if it uncovers an underlying process that we may not have known the severity of because we didn't
Mm-hmm.
ask all the questions, then I think that would be very useful. However, I don't think that's currently standard of care that everybody needs to be screened in those circumstances.
Mm-hmm.
But I think obviously people can access these tools online for
Mm-hmm.
screening. And if they're concerned or they're wondering and or they think maybe that they're concerned about how they're feeling or the length of time or the severity, then absolutely that would be the next step.
Mm-hmm. Mm-hmm. Okay. And then when do you feel that for the person, one of the things you mentioned is the pressure that they may feel that, it's time to move on. It's time to move on. And sometimes that pressure can come from within, sometimes that pressure can come from your colleagues, your friends, or even your partner. So how for when it's for instance the partner who may be having this has this stance that hey, we've lost this child, but it's time for us to move on, then there may be that discordance in grieving as far as timing. And that's the person that you may need to rely on more so than anyone else. How can one navigate that space?
Well, it can be really challenging. And I think a lot of people might feel hurt by that or feel rushed. It's not something that you can just wave a wand and
Mm-hmm.
stop feeling. So I think it's really important to hold space for those feelings. But
Mm-hmm.
assuming that this person in your life, this partner has your best interest at heart as well, and they're seeing you suffering, then maybe it is time to consider screening and consider seeking treatment for it. But
Mm-hmm.
when we talk about grief and loss, I think there's a lot of controversy in the community that manages that in other circumstances. When is when is it too long? If you're feeling intense grief after a year, is that a problem? And many people would say it is. And uh, previously, it can be called complicated grief, or well as like a persistent uh, type of grief. And sometimes that does need to be addressed with treatment
Mm-hmm. Mm-hmm.
because I think even if we don't agree on, well, what is the time bound for this? You don't get a certain amount of time to feel a certain way. I think that people can be, missing out on parts of their lives or just feeling badly. And I think if you want to, you know, get back into the swing of things and
Mm-hmm.
you're feeling compromised by the depth of your grief, then it is time to act.
Mm-hmm. Mm-hmm. And what are some of the treatment options that may be available to the person experiencing this?
Of course, that's a great question. Well, one of the standard treatments is therapy, and often this
Mm-hmm.
can be, there are a variety of therapeutic modalities that are effective in managing and processing grief. It can be cognitive behavioral therapy is one that's quite popular, and it's a way to give people sort of tools for how to manage these feelings, how to process them, and ultimately how to have some degree of healing. It's
Mm-hmm.
not that you'll never think about the event or remember the event or feel sad about the event. It's just that you learn how to manage it in a way that allows you to have some healing and to move on with your life.
Mm-hmm.
Now, certain people, many people do quite well with therapy. At Seven Starling, we offer individual therapy that's one-to-one, the patient and the therapist. We also offer group therapy. And I did mention this in the context that we were talking about on the last podcast, but I think there's something really powerful about being with people who've gone through the same thing as
Mhm.
you and getting support in the context of that group.
Mhm.
So group therapy can be quite effective here as well.
Mhm.
Um, Medication, psychiatric evaluation and medication is a very important treatment method as well. It's
Mhm.
not for everyone. Not everyone wants or needs medication. But by that same argument, not everybody wants or needs therapy. So
Mhm.
as a physician, if there are a number of effective treatments, I think it's really important to have shared decision making with that patient. What do they think is best? What do they prefer? How do they prefer to go about this
Mhm.
process? So, fortunately, we have a number of tools at the ready to help manage this.
Mhm. And I would imagine that the person may feel sometimes there's a guilt that comes from how do you put this? A guilt from not feeling grief by uh, 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 you feel like you're honoring the person by feeling sad about the loss. You're honoring them, and so in moving on, you're somehow betraying or not honoring that loss. Is
Yes, I think that's common, and people can feel guilty about that. And I
that?
think one of the strategies is how do you adapt to that? You're Would you never move on from it? Never? Are you to be happy or to consider, other aspects of your life? So I don't think it's a betrayal to heal. I
Mhm.
think it's a necessary and beneficial thing.
Mhm.
And moving on does not mean forgetting, okay?
Mhm.
Because they'll always be a part of us.
Mhm.
But I just think it represents maximizing your function and your ability to live your life and find joy.
Mhm. Mhm. I like that. I like that. Thank you so much for stating that because I do feel like sometimes people will kind of have that emotional conflict of uh moving on versus grieving and what is the best way of honoring that person that they have lost. Now, for the and I know we talked about the couples that grieve discordantly, and just with everyone else, everyone is an individual. So you may have recovered from the loss before your partner or vice versa. How do they how can what are some of the tools that you can use to not make that discordance of grief, of timing of grief, not create a conflict in your relationship?
I think empathy is key
Mhm.
and acceptance. People heal at different rates, people heal in different ways, and
Mhm.
people process grief differently.
Mhm.
And so, what one person is going through is different than their partners, but that doesn't mean it's wrong. And so, I think it's such a critical time to um, be easy on both yourself and your partner, especially if you have that discordancy,
Mhm.
because you have to leave room for those type of differences. You're not
Mhm.
going to be going through this process in lockstep at the
Mhm.
same pace.
Mhm.
Um, and we don't want that to become another conflict
Right.
and another point of
Right.
pain for the
Mhm.
couple.
Right. Right. And I love what you said. It's not right or wrong. It just is, right? Some people just
Yes.
it's we don't need to put a judgment on the grieving process or the timing of the grieving process for yourself or your partner. It just is.
Well,
So,
I'm sorry, it's really individual.
mhm,
And so, but I have seen it drive conflict. Someone says, "Oh,
mhm,
well, you're already over it. You didn't care about what happened."
mhm,
And that's not the case. People process emotions differently, people grieve differently. And it's a very difficult time. It's a very stressful time, but it's a time to not be judgmental about um, the differences, or as you put it, well, I thought discordancy in the
mhm.
grieving process.
So, how can you stay healthy and engaged while you're going through this process? So, the person who's has experienced the loss, they may be going through therapy, um, but they're kind of like maybe trudging along, putting one foot in front of the other. And is it gonna then be through the therapy? I would imagine that they get to that point of joy or resolution or resolve or whatever that recovery may look like for that person.
Yes, but I do think it takes time. How
Mhm.
much time? There are as many different answers as there are people for how long
Mhm.
that will take.
Mhm.
And, sometimes people will, if you've heard the saying, fake it till you make it, I don't necessarily find that helpful. It's obviously it's like pretty much uh, defines like inauthenticity in that sense. But I think um, it's really important to gather those tools for how you
Mhm.
cope and for
Mhm.
how you heal and to learn to move forward and
Mhm.
to allow yourself the grace to experience joy again.
Mhm.
Um, and so I think it's a really rewarding thing to see as a clinician, to
Mhm.
see someone sort of break out of that darkness.
Mhm.
Um, but for most of us, it takes time and it takes work.
Mhm.
But fortunately, we have the tools and the means to help people climb
Absolutely.
out.
Absolutely. And for the person who is experiencing this sadness and the grief from the loss, and now they have maybe be in the process of recovering, would it then be uh would you then how would you characterize the process of and I'm thinking about the person that may be experiencing infertility, for instance, then I'm not sure how did they decide, like, okay, do we get back in the saddle again? Do we keep trying? And do we, you know, what does resolution look like for some of the patients experiencing this?
Well, it comes again in as many forms as there
Mm-hmm.
are people who are on that journey. And I think for many people, when to try, when to continue the process, or
Mm-hmm.
when to stop and complete the process is very different. um, a lot of people would use the term giving up, and I'm not sure I agree with that term either, but I think even that is sort of the loss of the view of oneself as a
Mm-hmm.
parent or as a parent of more children than you currently have on the infertility journey.
Mm-hmm.
Um, but I think that's something that people come to over time after assessing their situation and
Mm-hmm.
after really taking a look at their wants and their needs. Um, Unfortunately, it's something, especially on the fertility journey, that finances come into as well.
Mm-hmm.
And so I have seen patients go through what's very much like a period of mourning if they
Mm-hmm.
are not going to make that dream happen for any variety of reasons, whether
Mm-hmm.
medical or financial. But that again is something that we can help with. How do you frame these issues? How do you move on from what's a tremendous difficulty or disappointment? And
Mm-hmm.
how do you move on with your life and find joy in what you have?
Mm-hmm. Mm-hmm. And find the beauty, right? Like you said, and the joy. Absolutely.
Absolutely. Yes.
Are there certain persons who are at an increased risk for experiencing these sadness, depression, or grief more so than others?
Yes. I think, as I've alluded to in the past, patients who have had previous mental health challenges can
Mm-hmm.
be at risk for a recurrence or for a future episode. But when you're undergoing fertility treatments, often it can be quite an arduous process.
Mm-hmm.
It can involve medications that are causing hormonal changes, and
Mm-hmm.
there may well be a hormonal component that either causes or in some cases exacerbates the symptoms as well. So that's something we take into account also.
Mm-hmm.
There can be physical stressors based on procedures and surgeries people may have gone through, whether it's infertility, in the context of a fertility journey, or having gone through a loss. People need occasionally surgical procedures or other procedures related to that. And
Mhm.
so all of these things can be additive. They can all have aspects that can impact on one's mental health. So
Mhm.
those are all things that we consider.
Okay. Okay. And then again, for the person who may be experiencing, who may be overwhelmed emotionally or grieved or having thoughts of harming yourself or others, please reach out to the Suicide Prevention Hotline by calling or texting 988. That's within the United States. Calling or texting 988. The website also for the suicide prevention is 988lifeline.org. 988lifeline.org. Dr. Roskin, is there anything else you'd like to add to the person who is experiencing these symptoms or is on this journey?
I think that it is so difficult what you may have gone through or be going through,
Mhm.
but there are ways that you can be helped, and there are ways that you can feel better. And so please be sure to avail yourself of all of the tools at your disposal to do so,
Mhm.
whether that's your support system, your healthcare providers, your friends, family,
Mhm.
or Seven Starling, or any other resource that you need. But
Mhm.
you deserve to feel better.
Absolutely. And always with my OBMD, we support you in every way that we can. We have resources on our website to help you on this journey as well, information and resources. And I just want to remind everyone that um reaching out for help is a sign of strength and not a sign of weakness. And so you always want to remember that it is a strong person. It is that advocates for themselves, acknowledges their need for assistance and seeks out that assistance. So please be sure to take care of yourself and find the help that is needed. So again, we want to thank so much, Dr. Roskin. We want to thank you so much for your time and your knowledge and your expertise on this very important topic of mental health and well-being for the persons who are experiencing recurrent pregnancy loss or pregnancy loss or infertility. And again, Dr. Starling is with the Seven Starling group, and that's seven, the letter SEVEN, Starlin, not Starlins, but starlin.com. And you can find more information on this topic and many others at the myobmd.org website. Thanks for tuning in. Thank you for listening to another episode of Straight Talk with My OBMD podcast. To learn more about this topic, visit our website at myobmd.org. Subscribe to our newsletter, follow us on Facebook and Instagram. I can't wait to spend more time with you on our next episode of Straight Talk with My OBMD.